Simran Chaudhary, and I welcome you all to Think Pink Advancing Breast Cancer Treatment Through Innovation, a virtual podcast series for Breast Cancer Awareness Month, October 2024. In this series, we'll explore groundbreaking advancement in breast cancer care, featuring insights from leading experts. And today, we are excited to have Dr. Shiveda Razna, a skilled breast oncoplastic surgeon with extensive training and experience. She completed her general surgery training at Jammu University and her senior residency at Vardhaman Mahavir Medical College in New Delhi. Dr. Razdan has served as an attending consultant at Medanta Hospital for 7 years and further trained in the UK, specializing in oncoplastic surgery and reconstruction techniques. With an MRCS from Royal College of Surgeons of Edinburgh and a fellowship in European Board of Surgery in breast surgery. Dr. Razdan is committed to advancing patient care in breast oncology. Currently, she is working with Amrita Hospital as senior consultant and assistant professor. Please join me all in welcoming Dr. Shiveta Razdan. Welcome to our show, ma'am.
Thank you very much.
Thanks a lot, ma'am, for taking out time out of your busy schedule and coming to this platform for raising awareness on Breast Cancer Awareness Month, morely on the treatment option, the innovations which are coming across because of all the advancements and research going on. So I will directly jump to the topic regarding this. So I would like to know what are some of the key skills and techniques that set oncoplastic surgery apart from the traditional breast surgery.
All right. So, mainly the aim of oncology surgery, any oncology surgery, is to remove the cancer, and there should be no residual cancer left in the body. Okay. So, in breast also, it is the same principle, right? But when we involve the oncoplastic technique, we are involving the oncological principles, that is, removal of the tumor without leaving any tumor behind, and using plastic surgery techniques to uh, maintain the aesthetic of the breast. So this is the principle behind oncoplasty surgery, where we combine the oncological principle and plastic surgery principle to maintain the aesthetics of the breast.
And now, if we have to talk about how has oncoplastic surgery evolved in recent years and what innovative techniques are now available to patients.
So, I have worked with surgeons. 20 years ago, the basic surgery was radical surgery for breast cancer, where you used to remove everything from breast, from muscles, and that was very devastating for the patient. But for the last 20 years, we have seen different phases in breast surgery, and now the aim is to remove minimal amount of breast tissue, and we maintain the shape size of the breast, right? And these days we have various new techniques have come in oncoplastic surgery, right? So we have what we call we use the local tissue to replace the tumor cavity, which is called volume displacement, and we use local flaps, surrounding flaps, to make a new breast. Okay. And we try to preserve the skin, the nipple, if we can. For example, if we are doing an implant based reconstruction surgery or a free flap based reconstruction surgery, we are trying to preserve the original skin of the patient, original nipple of the patient. That again gives more aesthetic sense to the surgery. And these days, so these patients, any breast cancer patients, we do a lot of pre-operative imaging so that we know exactly how big the tumor is, where the tumor is, how many tumors are there in the breast. That's how we help the patient make a decision regarding the surgery, right? So we these days we have 3D mammograms, which give a more authentic view of the it is a simple x-ray like a 2D mammogram, but it is more sophisticated mammogram than a 2D mammogram. We have the MRI breast, we have the contrast enhanced mammograms these days, we have the high resolution ultrasounds. All these imaging techniques have helped us to know exactly what is going on inside the breast, and that helps us in planning the surgery. These days in any oncology, we are doing multidisciplinary team management. Like, we discuss our cases pre-operatively, where medical oncologists, radiation oncologists, a pathologist, a geneticist, all, and even the plastic surgeon is there, and we then plan the treatment plan for the patient. Intraoperatively also we take help from the radiologist, from the plastic surgeons, and they help us. For example, radiologists, we make them tell if the lump is not palpable, or if the patient has received some form of chemotherapy, the tumor may have disappeared. And to localize that tumor, we the radiologist puts a clip in that area, and on the day of surgery we may put a wire in there, or even in we have newer techniques like some magnetic seeds or iron seeds are put by the radiologist, and we have some probes to detect those seeds during surgery. So that's how the breast cancer surgery, the oncoplastic surgery, has evolved over the years.
All those things are very fascinating and interesting, ma'am. And why we are focusing more on the treatment plans or the advancements of treating breast cancer is nowadays people are more aware of what exactly is breast cancer. Because of the celebrities being vocal about their journey, or because of the social media, everything is there, everything is available. But the only thing is, whatever they know, they should also know the way out to that, how the advancement has been evolved, how the research has helped in innovations and curing any disease, whether it was deadly or not. So I think that's how we believe in educating completely to all our audience. But all those things you just explained, I have one question on that. Does the sentinel node biopsy in the breast cancer is the same or something different? If different, then how it impacts the surgical decision making?
So for any breast cancer surgery, we have to do axillary surgery also, which is part and parcel of breast cancer surgery. So when we are doing for example, a breast conservation or oncoplastic breast surgery, we are removing the lump in the breast. Along with that, we have to check the status of the armpit or the axilla if the tumor has gone in there. Okay, so we do surgery for the armpit also in the same setting when we're doing the breast surgery. So what was done earlier 2 decades ago was to do an axillary clearance, which is removal of all the fatty tissue within your armpit or the axilla. That used to help us tell us what is the prognosis of the patient. If lymph nodes are involved in the armpit by the tumor, that means patient has a bad prognosis, and that used to help us in determining the further treatments what patient will receive. But it was seen that if patients who were not having involved lymph nodes by the tumor, uh, they were getting a lot of side effects in form of lymphedema, which is swelling in the arm, lot of pain in the chest area because the nerves get injured in that area. So then it was thought, why not to do something minimal for the armpit, because we are just staging the axilla, and it was not found to have any better benefit for cancer patients. So that's how it started. So sentinel node, if you the meaning of sentinel node is the first lymph node where the tumor cell will go in the armpit. So we try to locate that lymph node in your armpit and remove few of those lymph nodes and send for immediate testing to know if the cancer has gone into the armpit or not. So we have various techniques to detect those lymph nodes in the armpit. Normally we use some nuclear dye, technetium 99, which is injected into the breast, and we have some probes like gamma probe to detect that nuclear activity in the armpit. Also, we use some different dyes like indocyanin dye. For that, we use a fluorescence imaging to detect those lymph nodes. Or we use blue dyes like methylene blue, patent blue, isosulfan blue, and we then detect the color change in the lymph nodes in the armpit. That's how we detect those lymph nodes.
That's very very deep, ma'am. But thank you so much for explaining that to us and to all our audience, so that it all of us have the clarity over this, how this process works and what all things are involved. But I believe for us, there's so much of process to follow and steps to follow. So there would be some other challenges also. So what challenges do you face when implementing all these innovative surgical techniques, and how do you feel that we can overcome them?
So, as a breast surgeon, we usually have a lot of difficulties which we face day to day. first mostly is to learn breast surgery. It's a steep curve. Okay, so it's a lot of training going, a lot of years you have to put in to learn the breast surgery skills. So that period is very long. Second thing is, so breast surgery is not a, it's a team effort. So
Hmm.
you have to have a team to manage patients. For example, as I said, we have multidisciplinary teams. Mostly all the super specialty oncology hospitals have multi-disciplinary team meetings where we discuss all the cases and try to figure out what will be suitable for this patient. So it is more of a personalized treatment plan, or we call it precision oncology, where we make a planned treatment for the patient. And rest other difficulties which we face is, as I said, it's a multidisciplinary. We have to make an effort to, for example, the radiologist is needed during the intraoperative work. We need a pathologist intraoperatively. We need a plastic surgeon for the case. So we have to inform that preoperatively uh, about the case. That's will be done if we have a good nursing team. Good teamwork is required for all these things. So there are some hiccups when we have patients, and sometimes we lose time because of these things. One person is not available, then we have to postpone the surgery. So but we manage to deal with them.
I believe that is sure, ma'am, because like you said, a panel sits, a team of doctors sits whenever a case come or a patient is being treated. So with the expertise, the expert team you have, obviously there would be a solution, and you all guys work together to make it
Yeah,
as easy. Yeah.
yes, when we have a doubt what to do next, I just put that case in the multidisciplinary, then I will get the answers.
That's great, ma'am. I believe that's how the team works, and I will. We know that how selflessly doctor puts work together to treat any kind of any patient, any disease, so that they are satisfied that our patient is out of that disease, and they are doing their best whichever is possible for them. So thank you for that. Moving on, as we talked about the advanced treatment and every other thing, now we'll be focusing on patient centric care. So how do you ensure a patient centered approach when discussing treatment options with your patients?
So for us, patient is everything, right? So whenever a patient comes, we try to make them comfortable. We try to make a personalized effort to talk to them. It should be full of empathy, right?
Hmm.
And we should try to give all the information to the patient, right? So whatever the diagnosis is, whatever the treatment options are there, so tell everything to the patient. Okay, and then let her decide what she wants, because
Hmm.
ultimately it is the patient's decision which will matter at the end. All right. And I always tell my patients, because in India there is always a social stigma regarding don't tell the patient, or a patient will get a shock hearing that diagnosis. But I tell patient has, it's the patient's body who has to deal with it, so they are the first person and it's their right to know about their body, right? And that's how I go about it. And then I give them all the information, written leaflets. I give them links of some international links where they can, we have the NCCN patient centered guidelines which the patient can read, right? And then we show them photographs, that's how the breast will look after surgery, that's how we will put the incision, especially in reconstruction surgeries where the patient doesn't know how the breast will look like after reconstruction. So uh, that's how we deal with patients. And I think patient giving all the information is the key to success. You tell the patient what are the options, what can we do with you, and then let the patient decide what she wants. But we have to tell them what is oncologically safe for them.
Hmm. I think you said it right, ma'am. Patient education for what they are diagnosed, what are the treatment options they have is very important, because and then it's their decision. who you guys are doctors are guiding them for the safest and the better option, and they have to take decision on that. But just to have that trust over the treatment and the recovery phase, they're moving forward. This trust and this education, proper awareness of what they're going forward is very important. Then only they can have that phase. I'm moving in right direction, everything will be good, and at the end she'll be out of this cancerous tunnel she's going through. And yeah.
One thing I would like to end this patient-centered care. So normally patients have active treatments, they undergo, but when their treatments finish, suddenly patients have a gap. Now should they go back to their work? What should they do? So that period, what we call breast cancer survivorship, it is, I think, very important part of breast cancer treatment. So treatment, they might patient have 6 months, 8 months, 1 year treatments, but after that you have to give them support, right? So I always encourage patients to be part of some support group. I tell patients to join some support groups, join some yoga classes, meditation classes. They have to take control of their body. That's how I tell my patients.
You pointed out right, ma'am, because after that, once they're out of the cancer, the only thing they require is to go back to their normal journey, to their normal
Yes,
life.
yes.
And
We have to
it
tell them you can join your normal life.
yes,
That
and
message
sometimes
has to be delivered to them.
correctly, ma'am. And sometimes it becomes difficult because of they always have all those memories in their head what they went before, and it becomes little difficult to take that bigger step to move forward. But because of the guidance, consultation, and the counseling, it becomes easier. So moving on to the future perspective, looking ahead, what do you see the new trends or research areas do you believe will shape the future of breast cancer care in our country?
Definitely. Right now, we are going lot of breast cancer. Most of the research is going on in for breast cancer worldwide, right? So we are the future for breast cancer is bright, right? This time, as I said, we have more personalized management plan for any individual. So we can't apply the same principle to every patient. So uh, right now we are doing some genetic tests, genomic profiling to know the biology of the tumor, and the treatments we can give according to that, right? And we are having what we call targeted therapy. You must
Yes.
have heard about immunotherapy. There are something called monoclonal antibodies against breast cancer. So we have lot of options for patients right now at this moment of treatments for breast cancer. So, in if you talk about surgical aspects, what is the new in surgical? Uh, so we right now, as I said, reconstruction is going very high in patient, especially free flap and implant based reconstructions. In implant, I would talk about so earlier implants were put in under the muscle. So we remove the breast, we put the implant under the muscle. But right now we are doing what we call pre-pectoral implant based reconstructions, where the implant is just put above the muscle, because that used to cause a lot of morbidity to the muscle when it was manipulated. So right now we don't disturb the muscle, the pectoralis muscle. We don't disturb it. We just put the implant into a biological mesh or a synthetic mesh, and then just put it under the preserve the skin of the patient and put it under that, and that gives a lot of good aesthetic cosmosis to the patient.
Thanks a lot for answering that, ma'am. Because we actually want to, have an insight of how all these things work and to have a better knowledge. So, one more thing on this topic: how can healthcare providers encourage collaborations and innovation in the field of breast surgery? Because I believe that is most important. Because as we just talked, it's all team efforts.
Yes, yes. Surgeons can't work without healthcare providers. So surgeons need a hospital to work. We can't sit anywhere and start working, right? So the main the healthcare providers can provide with a good multidisciplinary team where they have a good, as I said, radiologist, pathologist, plastic surgeon. We need medical oncologists, radiation oncologists who are on board. So they should be, that team should be good. And it should be the duty of healthcare provider uh, to manage this group. So it should not be an individual duty. It should be the duty of healthcare. And also the healthcare providers should help the doctors to, they should tell them go to conferences, gain more skills. They should offer them leaves for attending the conferences, workshop, courses abroad. And they should also help in having a research team uh, in their hospital. They should encourage research, helping their junior doctors to attain more skills. That I will ask all the healthcare providers to provide to their doctors.
Said it right, ma'am. Ma'am, as we want to focus also on awareness and education, so how can we improve awareness around benign breast conditions and the importance of regular checkups so that more and more screenings can be done? It can, if there's a breast chance of breast cancer or it is breast cancer, it get diagnosed early so that the treatment option starts soon, and there's more risk or sorry chances of getting the breast cancer cured.
So I get a lot of patients who have just simple problems like breast pain, which is the most common benign breast disease. They come with just pain because they have a fear, anxiety of developing a cancer. They might have cancer. So I think patient education is a must. You need to inform them that you have pain, which is not a symptom, most common symptom of breast cancer, right? We get ladies who have no pain in the breast and they present with a lump, and they sit for years there on that. And they, when they come to me and I tell them, why didn't you come early? They say, because it was not paining. So education is a must. There is nothing more important than educating a patient. And I tell my hospital, let's do some health talks, health camps where we educate people that you need to look after your health, especially breast, because breast is the most common cancer. And we ask them to come to hospital to have a mammogram above 40 years, and we are providing mobile vans which have attached mammograms, so that we can go if patients are people are not coming, ladies are not coming to us, we need to go to the patients out there and do their mammograms free of cost.
That I believe that is the way, ma'am. Educating at a very early age, whether it is school, college,
Yes,
universities.
yes. Uh, Go and educate children, especially 15 above young girls. Go and educate college girls to know about their breast health, know about what is mammogram, what is ultrasound, why it is done, how it is done, to know about self breast examination where you check your breast yourself. So these should be the part of your health talk when you go there.
Very, very true, ma'am. And as much as screening camps can be, planned or executed at offices or any other proper institutes where we can have most of the scannings done as and get if something is wrong, it can be diagnosed early. So I think that is the way forward. Lastly, as we are moving forward to closing this conversation, so during this breast cancer awareness month, what key message do you want to share with public regarding the early detection and treatment, and awareing, motivating them and educating for regular health checkups or early screenings and scannings?
So, as I said, educate yourself that you need to check your breast. How That's what I'm talking of. Self breast examination is the main thing. Then go and get yourself a health checkup done. Do a mammogram if you are above 40. And if you are having any symptom in the breast, lump, some nipple discharge, even pain, okay, go and get it checked. Go and get it checked. That's what my message to the audience is today. Go and get yourself checked by a doctor, so that we catch the cancer at an early stage. If you catch cancer at an breast cancer at an early stage, 90% of patients can get cured. But in India, the sorry state is that most of the cancers we see in stage 2, stage 3, stage 4.
Hmm.
least cancers we see stage 1. That is a problem. So please, I tell my message is just go and get yourself checked by a doctor.
That is very clear, strong message that go get yourself checked by a doctor and be vigilant about your health, the changes your body is facing, or you're witnessing every day. So be vigilant about it, take actions, don't prolong it. So this is what we all are aim for, and that is why we created this session. The vision behind of this session was this only, that we can educate and aware as many as public we can, to educate completely about what exactly this is, what the treatment options, the future, and how they can prevent this. So thank you so much, ma'am, for becoming one of a very strong voice for Breast Cancer Awareness Month, for spreading this awareness and educating our public, because it matters a lot when doctors come to a platform, share their insights and expertise with our audience, and educate them. So thank you so much for
Thank you.
this.
Thank you very much for calling me to this platform. It was pleasure talking to you. Thank you very much.
Same here.